and welcome to Life of a Diplomat. I'm Ainuri Mangali. Today we have a guest with more than 30 years of experience in public health and international cooperation. Leading the World Health Organization's team here in Kazakhstan, he strongly advocates for a multilateral approach to addressing today's healthcare challenges. He has also described the cooperation between Kazakhstan and WHO as a model for other member states of the organization. What important initiatives will further strengthen this partnership in the near future? We will find out today. Joining me now is Dr. Skender Syla, WHO representative in Kazakhstan. So let's get started.
Kazakhstan made a huge progress in improving quality of life of the people.
What do you believe international best practices could be especially useful for Kazakhstan healthcare reform?
Kazakhstan can combine Western practices, the practices of this part. Now we are working on more together with Kazakhstan government in modernization of rural healthcare. Our policy is to save lives and make world better and safer for each and everyone.
Hello,
Welcome.
Nice to meet you.
Welcome.
And welcome to the program Life of a Diplomat. Yes, let's go.
Great to have you here. Welcome as well.
Mr. Syla, thank you very much for being with us today. Let us start our conversation. First of all, how would you describe the main health priorities, public health priorities for WHO in Kazakhstan today?
WHO priorities in Kazakhstan are related to the needs of the people of Kazakhstan. We work on several areas which are crucial to strengthen further public health to this great country. First is environment and health, because environment is critical for our health and well-being. The second area of our work is addressing risk factors of the people, like tobacco use, alcohol use, nutrition, physical activity. We work very much also in further transforming of primary healthcare and other services. One critical part of our interventions is related to immunization, because we know that vaccine preventable diseases are very important for healthy generations. But we work also on digital health and on emergency preparedness and response. When it comes to emergency preparedness and response, we have a large project which is funded by Pandemic Fund of the World Bank of the 3 years project, about $20 million, in which we aim that the country will be, the health system in the country and public health response will be adequate to the future pandemics that might happen in the future.
Being here in Kazakhstan, working in Kazakhstan, what are your thoughts on Kazakhstan's progress in strengthening its health care system in recent years?
From 1978 of Almaty Declaration, Kazakhstan not only helped to transform healthcare system in the country, but also it helped together with WHO to shape the global health agenda. In recent times, under the initiative of President Tokayev and General Director Dr. Tedros, is being created global coalition on primary health care. Up to now, this coalition has been joined more than 26 countries from all continents of the world, and they want to transform the healthcare where services are closer to the people, closer to clients, more affordable, and there is no financial hardship for community and people to pay. And even in recent time, we had a visit of our Director General and Regional Director. We met with high-level officials in Kazakhstan, and this partnership between World Health Organization and Kazakhstan will continue to further transform the healthcare system. Apart from primary healthcare, Kazakhstan made a huge progress improving quality of life of the people. Life expectancy has been increased. maternal and infant mortality have been reduced. Quality of care of health services at all levels have improved significantly. We have centers of research that are treating complicated cares like Cancer Research Center, Cardiology Center, and all this, they are making also great network with different modern countries towards modernization, further modernization of healthcare systems.
Yeah, I think those initiatives we can consider as, tangible achievements of cooperation. But what other areas of cooperation, as well, have achieved, these very important results when we talk about cooperation?
Well, our modality of work is based on so-called country cooperation strategy. These key priorities are jointly decided to be taken forward together with WHO and local health professionals. One of key areas of our intervention is human health workforce. We want to invest in the human capital through training, through capacity building, through sharing the knowledge and experience from other countries, that the health workforce of Kazakhstan healthcare professionals are at the highest level of professionalism, ethical conduct, but the most important is providing a quality of care for the people in need in all parts of the country. Now we are working on together with Kazakhstan government in modernization of rural healthcare. Not only building new healthcare facilities, but these healthcare facilities, they have a right mix of health workforce that whenever clients are going there, they would receive appropriate care and when needed also to be referred.
Okay, now let me mention the climate change issue, environmental health. As well, you know that at the recent Regional Ecological Summit, President Tokayev addressed the most challenging environmental issues for Kazakhstan and for the region. How does your organization see its role in addressing these issues and, of course, finding solutions to improving situation in public health of that particular region?
The Aral Sea is a testament that how human activity can degrade the environment that we live, work, and prosper. The World Health Organization is pleased to work with Kazakhstan government in order to address health-related impact of the Aral Sea. Our agenda is to support local authorities. We will work also with Kızılırda region, but also Aral region for industrial impact to the health, in order to do research, to do studies, and also to find the mitigating measures in order that local communities can undertake to save the current and the future generation. That's why we bring the best experts. We will cooperate with the highest level institutions in UK and in other countries through WHO collaborative centers, that we can bring highest level of technical expertise, scientists, in order to design, to implement, and to make impactful process in helping people to mitigate and to reduce the impact of the Aral Sea through environmental intervention. Already there are interventions there.
Yes, and climate change is increasingly recognized as public health issue. And in what ways it affects health systems and well-being of people nowadays, and why is it important to address it right now?
Climate change is unfortunately part of our daily life. Rising temperatures, flooding, heat waves. All these are affecting human health on a daily basis. Even there are studies that during heat waves and increasing temperatures, the suicide rates are higher in many countries. So the effect is tremendous on human health by having more mortality, more morbidity across all regions, but also in our region. Air pollution is another component that is affecting hugely, and that's why the key message is that human-related activities should be more responsible
Yeah.
in the future because we do not have other planet. The Earth that we're living gave us a lot. I mean, we live here, we work here, but we need to save our planet. And we work also on One Health approach in order to address environment, ecological, animal and human health.
It's very important. Now, let me mention the healthcare reform that is currently happening in Kazakhstan, and it's aimed at improving accessibility and quality of medical services. So how does WHO, your organization, support these efforts?
For good performance of any health system in the world, there are critical the following components: governance of health system, health financing, quality of health services, and health and care workforce. On all these areas, we support Kazakhstan to transform health system. From governance, like that the health system is governed in the right way, from at all levels, from Ministry of Health to district level to the remote village in ambulance, where the empathy for the people, where the professionalism, where the motivation and dedication are at the highest level with highest ethical standard. The second is the healthcare financing, and we have Center of Excellence in Barcelona because we are not only the team here, which is composed by 18 staff members, but we engage all levels and the expertise of organization from Astana, Copenhagen, Geneva, Barcelona, Venice, and others to bring the best excellence in order to work with health authorities and to design the best healthcare financing that would prevent financial hardship for the people. When I'm saying financial hardship, that when the people get health services, that they will be able to pay appropriately and also timely, and also they will get time services.
What do you believe international best practices could be especially useful for Kazakhstan healthcare reform?
Well, the international experience clearly shows that it cannot be imported any model from there. Kazakhstan can combine Western practices, the practices of this part. We have, for example, organization of Turkic states. Turkey is also a country which provides a good reform on healthcare system. So analyzing different systems, but always the lead of transforming health system should be local professionals. And I have to say that I am inspired, I'm impressed by day-to-day work with my own local staff, but also healthcare and professionals. Not only the interaction that we do, even in English language, but the way how they think, the aspiration they have, the motivation, and particularly young generation. This country has legacy on investing, on educating people abroad. And this is critical because these people that are graduating, being educated abroad, coming here, they bring this experience, but also networking with many institutions.
Now let's address the challenges to the global healthcare system as well. In the context of pandemics, right? The COVID-19 pandemic showed us the importance of preparedness and international cooperation again. So my first question here is, what lessons should we retain from that experience in the first place?
The COVID-19 pandemic has shown very clearly that when health is at risk, everything is at risk.
Yeah.
It's about health security. It's about national security. The lessons learned are very clear. In any kind of public health emergency of international concern, there should be solidarity. There should be inter-country cooperation, transparency, sharing the data, sharing the experience, and being solidar with each other. We know if there is a virus somewhere in the world, it can spread faster to all parts of the world. When the vaccines is available in one country, it should be shared with other countries. Even now with hantavirus, we have shown how fast the world has been mobilized under leadership of World Health Organization. Dr. Tedros was recently here in Astana participating to ecological forum. Yesterday he was in Tenerife in Spain together with Minister of Health, and they were waiting for passengers to disembark, to go to their own country. And it shown the value of World Health Organization as authority, as coordinating body, bringing the best available evidence and science to the people, but also coordinating, because our policy is to save lives and make world better and safer for each and everyone.
How would you assess regional cooperation, I mean, here in the context of Central Asia, for example, to improve and to strengthen this health security when we talk about preparedness to the pandemic?
Among Central Asian countries, there is a great cooperation. We have had the roadmap for health and well-being of Central Asia, of all countries that they have signed it. It ended last year, and we are making a new one for until 2030. Even now, during the World Health Assembly in Geneva, in about 10 days, they will sit together and decide about the action points and which areas we can cooperate. Because inter-border collaboration, sharing experiences in different fields of public health is critical in this part of the world. We can learn from each other. We can share the knowledge, but the most important, to show solidarity and unity when it comes to different emergencies, like these public health emergencies of international concern.
So now, what motivated you to pursue a career in global public health and international cooperation?
By background, I'm a medical doctor, family physician. I graduated in my home country in 1995, and I worked several years as a clinician. But during the war in my country in 1999, I saw the importance of helping people in need during emergencies, public health interventions, and I joined International Medical Corps in 1999. It's a non-governmental organization that supports people in need in conflict zones, areas. And from there, I was also a refugee, again helping people in need due to that circumstances. And in 2000, I joined World Health Organization. So I'm working for almost quarter of century with this organization. And if I would return back 1,000 times, I would continue to do the same. Of course, I have international master degree from University of Copenhagen, and this is combined also my professional background, but also passion, motivation, dedication for public health and helping people.
Now you're representing WHO here in Kazakhstan, and I'm wondering, what is the most rewarding part of your work here in this country?
I didn't know much before I came to Kazakhstan. I read few articles and I didn't have a complete picture about the country. There are more than 3 years that I'm working here in Kazakhstan, and I enjoy every single day. The most rewarding part is my team. I have great team Kazakh professionals. The only me is international. All the other staff are local one. I can see into their everyday work, motivation, dedication, passion for the work. The second is hospitality of the Kazakh people. I was invited to their families, trying bishparmak and other traditional food. But this reminds me also of my home country. Hospitality is the greatest asset that we have, and we say that home belongs to the God and the guest. And I found the same attitude, the same feature to the Kazakh tradition and culture. I found here also great family connection, because family is the cell of the society. So these are elements of day-to-day life. Another is professional aspect. We have great cooperation with government of Kazakhstan, and due to this great cooperation, not only that we are contributing to transforming health system here in this part of the world, in Central Asia, but also shaping global health agenda through primary healthcare coalition.
And summing up everything that we discussed today, again, why is it important to stick to international solidarity and multilateral action when we face and when we address global health challenges?
The international solidarity, cooperation, and also empathy between nations and people is critical during normal situation, but particularly during public health emergencies of international concern. And if there is no cooperation, the virus will be more deadly to each and every one. And humanity, all the people, all the communities would be at risk in case that this cooperation does exist. And that's why WHO is the most appropriate, most evidence body that can coordinate this international response to these public health emergencies.